Cassidy here, clinical psychologist and owner of Prosper Health Collective in Burragoon and Canning Vale. So today I'm going to talk a little bit about trauma. It's our kind of topic for the month that we're focusing on, and you'll find lots of information on our Facebook page and on our blog on our website at prosperhealthcollective.com.au that is really giving people information about this topic, and it is a really, really important topic. Most people will experience at least one traumatic event in their life. Now, not everyone is going to develop a mental health condition from experiencing a trauma, but a lot of people do. So it's important that we understand that and we know a little bit about it. Now, trauma, when I use that word trauma, I'm talking about something that results from an extraordinarily stressful event that shatters our sense of security, makes us feel helpless, and that we might be living in a really dangerous world. Okay, so that's a type of thing that I'm talking about when I use that word trauma. Now, that can happen from a whole host of different events. And there's something really important to consider in terms of trauma from our perspective when we're treating people who've experienced trauma, is that we look to whether they've experienced a single incident. You know, they've been through a bushfire or a flood, an assault perhaps, car accident, those sorts of things, and it's a one-off event, versus something that has occurred for a long period of time, and we tend to call that complex trauma. So there's a big difference there because the way that we go about treating it might be different, and also how it looks to people might also be very, very different. Quite often in a single incident, people experience what we call PTSD, post-traumatic stress. And that is often associated with having flashbacks of the event and being very hyper-vigilant and not being able to process that information and let it go, basically. And again, not everyone, when they experience a stressful event, will develop PTSD. Complex trauma, on the other hand, is more likely to be what we call interpersonal. It's occurred between two people. It's more likely to have gone on for a long period of time, and it's more likely to have been planned, that the person inflicting the trauma has actually planned it, rather than a flood. No one can plan or predict for that. It just happens. Often as well with complex trauma, we're looking at experiences of shame, of loss of trust, impacts on self-esteem, identity, and the capacity to regulate emotions. So it's having a far wide-ranging impact. It usually involves feeling trapped and has certainly a huge impact on both physical and mental health. We also tend to find that people who've experienced complex trauma are more likely to use different coping strategies as well. And it can be harder to identify because often people aren't going to talk about this stuff. It may have happened many years ago. They might not be getting the flashbacks of PTSD, but it can still be having a huge impact on their life. And often it just isn't picked up. The good news about both single incident and complex trauma is that there's some really good treatments out there for them. And seeking assistance can really help people when they're struggling with those things. So I want people to know that they should be looking for help when they're struggling. Now, some of the signs that you might look for that might indicate that you need to go and get some help are when you're having trouble functioning at work or at home, when you're having really high levels of fear and anxiety, probably experiencing some depression. You might be having trouble forming really close, satisfying relationships, or you might be able to form them, but they're not lasting and maintaining for very long. You might be experiencing those nightmares, flashbacks, and re-experiencing the event. You probably find that there's things that remind you of the trauma and trigger you off as well. Or equally, you might have found that you've just kind of closed off, that you're really numb and disconnected from everybody. Quite often we might associate trauma with people who are using drugs and alcohol as well, so that might be another sign to look out for. I hope that gives you a bit of information and makes a bit of sense about what trauma is. As I said, over the next few weeks through August, We will be providing other information, other tips, some reviews of apps and different resources that people can go looking for when they're experiencing trauma. But also, you know, if you're struggling with some of the things on that list, please reach out to us at Prosper Health Collective. We're here to help, and there are a number of psychologists at our practice who are really, really good at assisting people with trauma. I hope you find that useful. As always, here at Prosper Health Collective, we're working together with you to help you flourish and thrive. I will look forward to speaking with you again very, very soon, but bye for now.